Hi, I'm Dr. Chris Young. I'm the co-founder and director of Behavioral Health Center in Grand Junction, Colorado. I'm also a consultant with the Integrated Medical Center in Junction. And I'm here tonight to talk about some paradigms that have been used in healthcare actually throughout the century. And I want to propose a new paradigm, particularly one that is geared towards chronic illness and treating and managing those wide variety of disorders that just don't seem to go away. With chronic illness, the illness may persist without any clear indication of damaged tissue or disease process. Chronic illness is often called a disease of function or dysfunction. As we're going to see in a minute, chronic illnesses tend to be what's called multi-systemic. They occur in many different systems within the body, and oftentimes the problem is that these systems are not working effectively with each other. So chronic illness, we can run down through one system. Remember, once we cross into this system, we're pretty much, as far as our diagnosis and treatment, we're locked into that system. And we're locked in to the types of doctors that treat it. And here's where we run into a problem from many patients' points of view. What we have, the law of the lamppost says that we are limited by our ability to look at something. All right? A lamppost shines a light. You can only see where that light shines. If I'm only looking at the nervous system, that's all I can tell you about. If I'm only looking at the joints, if I am only looking at the heart, that's all I can tell you about. I can't tell you about the interplay and interreaction with other systems. I'm limited by where my light shines. Illness is a multidimensional thing. It's not just a single pathogen. And this is where we're going to have to do as much work in this society working with patients' understanding as we are providers' understanding. Because one of the things I hear the most from patients is, I just want to get fixed. So that's the first thing that's different about this model, is it puts both power and responsibility back in the hands of patients. Second, collaboration and respect amongst professionals. People who are trained to intervene at the varying aspects